Hi guys, it's Dr. Selene. I want to talk to you about where we place filler in the face. And so some of the main areas where we put filler are mid-face, meaning in the cheek area. Sometimes we start here and go out, and the theory is that that can pull some of this up. And so you can put a little bit in there. You want to be careful because people with fuller faces like mine, you can look overly full and lose your eyes. You don't want that to happen. Or if you get a weird looking cat lady look if you put too much filler in that zone. You can also put it in the tear trough area, the under eye area, if you've lost some volume in there. It's not for everybody, and you definitely want to make sure that your injector does that regularly because it's a tricky area to fill. We also fill in the temples in this little area. Sometimes you'll see some thinner girls, or as we age, you start to look like a peanut head, so you lose some of that contour, and we can put filler in there. Keep in mind that that's an area that sucks up a lot of filler, so you want to plan on having reasonable expectations for that. Another area that does take a lot of filler is the jawline. So I know you guys have seen that on social media where people are kind of creating a jawline. I think those results also are limited without a lot of filler to use. The one that I really love is the chin. You don't realize how much profile balancing just having a little bit of a chin gives you, as well as in theory pulling some of those jowls out. So it just kind of softens that whole lower face and the profile just looks better. Of course, everybody knows that we do filler in the lips just to add volume, help soften some of the fine lines, and as well as the nasolabial folds and the marionettes. So it's great for volume loss. Remember that if you have lots of little wrinkles, there's other modalities that might be better for that because filler just fills in wrinkles. But what it's really meant for is for volume loss and hopefully some contouring. It's controversial whether it really lifts and does anything to really pull things up, but you can imagine if I have a little bit more volume here, it might release some of the weight of the lower face sagging that we're getting as we age. We love filler when it's appropriately placed and when you use enough to actually see results. I'll tell you that most people that I see can take at least 3 syringes, which is why we do that on a special pricing basis for you guys, because we actually want you to see results. And if you see results with 1 syringe online or things like that, usually that's just in one little area, like the lips. So you get to pick one area if you're just doing 1 syringe, but if you're doing multiple areas, it typically takes multiple syringes to get those results. I hope that helps you guys in your filler journey. Take care. Bye.